Everybody. I think we're at 5:01, so we will begin. Thank you so much for joining us today. On behalf of Sattva Knowledge Institute, I'd like to extend a very warm welcome to all of you joining us in the second webinar under the Sattva Knowledge Institute's Touchpoint series. This series of webinars is designed as a set of knowledge-driven interactions with members at Sattva Knowledge Institute, along with eminent sectoral experts. During these interactions, we introduce our audience to key topics where we see interest and traction across the ecosystem and provide them with not only information, but help with making decisions in an evidence-backed manner. So I'm your host today. My name is Lakshmi Sethuraman, and I head the health practice at Sattva Consulting, where I lead all of our knowledge work out of Sattva Knowledge Institute and advise on many of our health engagements. For today's discussion, we are going to be focusing on the topic of digital health and how we can make digital health work for underserved populations. I'd like to introduce our very eminent expert for today's discussion, Professor and Dr. Dorairaj Prabhakaran. Dr. Prabhakaran is an eminent cardiologist, epidemiologist, and academician of global repute. He moved beyond the conventional world of clinical cardiology to advanced science in the prevention of heart diseases and diabetes in India. He's currently Distinguished Professor at the Public Health Foundation of India. At PHFI, he has been instrumental in establishing the Center for Digital Health. Over the last 15 years, Dr. Prabhakaran has focused on developing low-cost health solutions, including frugal technologies that enable task shifting and clinical decision support across community, primary, and tertiary settings, using a variety of methods, including clinical trials and observational studies. At PHFI, he also established the Center for Chronic Disease Conditions and helped build the Center for Environmental Health. He's also the executive director at the Center for Chronic Disease Control, which is now considered the leading research agency for chronic diseases in India and developing countries. He holds professorships at PHFI, at the London School of Hygiene and Tropical Medicine, and Emory University. In addition to this, he's a visiting scientist at the Harvard School of Public Health and an international fellow at the Population Research Institute, McMaster University. Professor Prabhakaran was elected as a fellow of the Indian National Science Academy. He's won several awards and accolades, including the Quality Champion by QCI, and he was conferred the Doctor of Science by the University of Glasgow. Thank you so much for joining us today, Dr. Prabhakaran, and a warm welcome to you. I'm really looking forward to your insights.
Thank you, Lakshmi. Thank you for that very generous introduction, and warm good afternoon to everyone on the virtual world.
So today's discussion is structured in three parts. We will start with the landscape of digital health, including looking at some of the existing solutions and tailwinds that are focused on bringing digital health at a large scale. The second part of the discussion will touch upon some of the challenges that we face in deploying digital health solutions towards underserved communities. And finally, we will look at solution areas and interventions in addressing these challenges, and also discuss the role of philanthropic and nonprofit actors in this regard. We'll then conclude with a Q&A where we will take questions from the audience. My request is please do put all your questions on the chat, and we will take it towards the end of the session. While we may not be able to take all the questions, we will try as much as possible to take all the questions that we can. But in case we are unable to, please be assured that we will respond to these questions offline subsequent to the discussion. During the course of the discussion, we will also draw upon some of the knowledge products developed by the Sattva Knowledge Institute, including in partnership with the Center for Digital Health at PHFI, which brings in insights and recommendations from expert consultations that we have had on this topic in the past. So digital health as an area has been gaining prominence over the last few years, as you may all be already aware, and particularly during the advent of COVID, we saw increased traction. So there were 50 million Indians that accessed teleconsultation services just in the period between March and May 2020. There was an increase of over 300% in patient traffic on leading health tech platforms during the pandemic. There's also significant investment that we are seeing in the digital health space. The telemedicine market is poised to reach USD 5.5 billion by 2025. And the digital and health tech ecosystem has already received over 5 billion in investment from the VC community. So overall, digital health is gaining significant traction. The potential for digital health in advancing universal health coverage has also been gaining prominence and validation from the global community. WHO has agreed on a mandate for digital health as a tool in advancing universal health coverage. UNICEF has already put it as part of their design mandate in terms of implementing solutions for the last mile. And several governments have also been thinking about digital tools and technologies as they think about healthcare delivery. So while this is very promising, one of the things that we're also finding, and one of the things that we have to be cognizant of, is that digital health has to be delivered in an equitable manner, right? Both in terms of the benefits that it offers, as well as the population that it's looking to serve. And a recent analysis by the Satpa Knowledge Institute of about 45 solutions that were that we studied, many of which was also integrated with the Ayushman Bharat Digital Mission, found that less than 5 of these solutions were actually accessible to underserved communities. So this also underscores the point that we need to take a targeted approach to ensure that solutions that are created are relevant and have the necessary enabling environment, as well as ensure that the value from these solutions is not just for the citizens, but also for health workers that are involved in deployment of these solutions. So given this context, Dr. Prabhakaran would love to start with maybe looking for your comments on the larger digital health landscape, right? And where you see some of the tailwinds and some of the solutions that already exist, particularly focused on underserved population in the context of India today. Dr. Prabhakaran.
Thank you, Lakshmi. I think you said a lot of things about digital health, but I think somebody's saying they can't hear. So are you able to hear me? Lakshmi, are you able to hear me?
I am able to hear you, Dr. Prabhakaran. Yeah.
Okay.
Yes,
so
I think you're audible. Yes.
Okay. So I was saying you said a lot of things about the digital health, and it's an exciting area and an exciting disruption that's happening in healthcare, not only healthcare, but across several services that are being used now. But having said that, I think first thing that we should understand is what does digital health means, because it means a lot of things to a lot of people. Some people call it e-health, some people call it m-health, some people even call it teleconsultation, telemedicine. A lot of names are given to digital health. But essentially, in simple terms, the definition is given here. It refers to the use of any digital, mobile, or wireless technologies to support the achievement of health objectives. That's the simplest definition that is possible. But within that, it encompasses several things. It can be used as a diagnostics tool. It can be used as an electronic decision support system for database treatment decisions. It can be used in the continuum of care, even from health promotion at one end to rehabilitation at the other end. It can promote self-management of individuals, because I think we are talking of team-based care, we are talking of partnership with patients, and I think this is a great tool in terms of self-management. And it also is useful in capacity building, particularly in terms of providing evidence-based knowledge to individuals. And in this process, I think in digital health, there are several tools that are available to us. We have AI-based systems, we have machine learning, we have Internet of Things, we have even the blockchain technology. I mean, it's not a great word, but it's a useful word, particularly when we think of security of maintaining the data and ownership given to patients. And obviously, big data analytics come up with several new things which might be useful. Particularly in terms of assessing nutrition, for example, AI-based system is a great solution. Your second part of the question was on the tailwinds. You actually mentioned most of the tailwinds that are there. availability of smartphones and internet, the democratization of data. There are several tailwinds that are available. Interest from the government itself is a big plus, and the government is pushing many areas of that are helpful for digital health. There is also private sector investment, government investment by charitable organizations, by philanthropy, and the whole ecosystem of these startups and the unicorns also are promoting the use of digital. All of this, I would think, are important tailwinds for digital health. I'll stop here, but you can, I will answer whatever further which I've left off.
No, that's very helpful, Dr. Prabhakaran, and thank you for laying the context. I think the point about also defining what digital health is an important one, and many people, like you said, use it in different ways and interpret it in multiple ways. I also just want to touch upon a little bit, Dr. Prabhakaran, basis your experience as well, in terms of what you see as tailwinds, particularly for underserved populations, right? And what you have, what you think are enabling factors. And also, if you can throw light on some of the solutions that you have seen that have worked well in these contexts, I think the audience will be very happy to hear that. Yeah.
Right. So I think, as I pointed out earlier, digital tools have a great role in democratizing healthcare and improving equity. Just to give an example, one, it improves access. I think the most important thing in terms of ensuring equity is improving access, particularly not the way we are conceiving telemedicine, to give you an example, but an assisted telemedicine program, which we have been using, is extremely useful in terms of enhancing the access, because there is both general problem with literacy as well as digital illiteracy. And therefore, given that our population size is huge and we have a whole range of youngsters who can provide support to people who are unable to use some of these technologies, assisted telemedicine is an example of improving access. Second is, given the shortage of physicians across the country, given the shortage of specialists across the country, we could use digital technologies in terms of providing virtual consultations, in terms of providing assisted solutions. Like, for example, a patient can come to a clinic where a nurse or a community health worker who has been trained in terms of obtaining history, in terms of doing a physical examination and presenting it to the doctor or the physician or the specialist in a concise manner, would be extremely useful. In the current paradigm of teleconsultations, what generally happens is the patients themselves generate this teleconsultation and they're unable to actually provide the right kind of history. And of course, the examination is not done. So there are a lot of issues that can be taken care of. And even the other big problem that we face in terms of digital health is the interoperability. And in our own system, we have overcome this interoperability by making multiple devices talk to each other. The third way access helps is, just to give a case study of a patient. Let us say a patient has diabetes, comes to a primary care physician. The physician sees the patient, gets orders a blood sugar, hemoglobin A1C to be done. Then the patient comes back, and let's say the blood sugars are very high and patient requires insulin. The primary care physician is diffident to start, so patient is referred to an endocrinologist. Now, the whole process takes 2 to 3 days, and that's a lot of time for people. In the new paradigm where we can use teleconsultations, you can actually do this. And if you have a point of care device, for example, you can actually finish this within 2-3 hours. And if you pair e-pharmacy, like pharmacy which delivers drugs at home electronically, we can actually even reduce that reduce time to the patients further. So that's one basic thing that helps in terms of ensuring equity. But it also goes beyond that. It's useful in prevention, it's useful in screening, treatment, rehabilitation, every possible thing that we can conceive of. For example, we can use longitudinal electronic health records. We can do predictive analysis, AI-based analysis in terms of identifying what are the good health behaviors or good behaviors for leading a healthy life. those can be identified. One of the complex things that we find is dietary advice. And we really do not know what patients take. And we have been using techniques like 24-hour dietary call, food frequency, which are not, which actually do not give exactly what the patient eats, the person eats. Now we have AI-based system where a simple photograph can tell what exactly the person is eating. And that's a great example of how we can use it for prevention. In terms of screening and diagnosis, newer and newer technologies have come, particularly in terms of diagnosing cancer earlier, in terms of diagnosing oral cancer, where we can take buccal photographs and use AI-based system to predict whether it is malignant or benign. In terms of treatment, many systems have come in, including robotic surgery, Internet of Things, and several others. And in terms of rehabilitation, home monitoring for people. In fact, it reduces the footprint to the hospital. And overall, I think digital health can actually be a mitigator for climate change, because the amount of carbon footprint that is reduced is enormous. So I think these are many things that digital health is useful.
Thank you so much, Dr. Prabhakaran. I think very exciting use cases, and again, highlighting the potential for this very strongly. So, I think this is a good segue, Dr. Prabhakaran, to sort of go into the next section, right? Which is, while the promise of digital health exists, there are several challenges as well, right? And how do we ensure that digital health is delivered equitably? And I want to touch upon the challenges a little bit more deeply, and would love to have, our audience members also participate. And many of you are practitioners, many of you deploy digital health solutions in the work that you're doing, or aware of how digital health solutions are being deployed. And we'd love to hear from you. We have a Mentimeter poll that our team will just leave the code on the chat. It'll be great to hear from you on what are some of the common challenges that you face as you, as you deploy these solutions. Ritika, can you just bring up the code?
Share it on chat.
No, Ritika, you have to share it with everyone.
Yeah, just put the code on the slide. Yeah. Can you bring up the slide as well, please, Ritika? Lack of sustained capacity building. Yes. Absolutely. Digital infrastructure, connectivity. Right. Yeah. I think several things that are coming up, Dr. Prabhakaran. One is on the digital infrastructure piece. Two is around capacity building itself. Three is trust among the patients at one end, and political will at the other end in terms of making this happen. Looking at digital and physical, and how do you bring that together? Also looking at biases potentially that can come out of some of these solutions as well. Consent and privacy. I think there are other points that are also coming in, which are more specific to the ABDM construct as well, in terms of looking at value from registering for the Aadhaar, registering for HPR, HFR. challenges with deployment of these solutions themselves in public healthcare settings. The fact that there are so many solutions already. So I think, as you can see, Dr. Prabhakaran, I think the challenges are plenty, right? And I think that we need to understand this, and would be great to have your insights on these points as well, Dr. Prabhakaran, basis your experience on how do you see these challenges as well, as they play out.
Right. I think this is tremendous. Actually, I'm just blown away with the kind of things people have come up with in terms of challenges. To me, I think there are 4 important challenges. One is equity, as you pointed out, the gender gradient, the number of women, for example, owning mobile smartphones or access to internet. I think unlike the high income countries, there's a huge gradient. It's almost 40 to 50% gradient. I think if I get the numbers right, nearly 60% of men have access to internet, adult men have access to internet or smartphone, whereas only around 31 to 35% have. So it gives anywhere between a gradient of 40 to 50%. So that's huge. Second, of course, there's a urban-rural divide. Again, this is more than 50%. Urban, around 60% of people you have access to internet or smartphones, whereas rural, it's only around 25%, huge gradient again. The third barrier is actually the number of people who have the age. For example, the elderly people have to the tune of, if I recall the numbers correctly, around 5 or 6% only have access to internet beyond the age of 60 years. So that's again a big problem, because they are the ones who will benefit most from digital health. Then I think the big problem which I foresee in terms of bridging the divide is our solutions are top to bottom. I mean, it's largely decided somewhere. Experts decide and then go and implement it in the community. I think we require some grassroots connectivity, grassroots connection in terms of whether it is culturally acceptable, whether it is specific to a given context, whether it will be affordable to the community or even to the individual or to the system. Then are there any systemic issues in terms of infrastructure? We have this outages of power, we have poor internet connections. So can we create solutions? So, but for all of these, I think I would see every challenge as an opportunity. And one of the things we have been doing in terms of looking at promoting digital health is talk to people. And there are several new techniques which are actually used in the market. People use it for advertisement and others. Before advertising a new product or before promoting a product, they do what are called discrete choice experiments, and they go and talk to people saying, we have this product and we have that product, which do you prefer and why do you prefer? And they get it in a very, very quantitative way, even though it's a qualitative questionnaire. The others is doing surveys. So there are various methods now that are available to us. So I think it's important that we co-design any digital health intervention with community participation and with policymaker inputs. Otherwise, it cannot become sustainable, neither can it be scalable. And we always need to focus on cultural issues, the context in which we are doing this, look at the cost and the cost effectiveness, and look at whether the health system is ready. Has there been enough training? Has there been enough? Will there be enough acceptability amongst healthcare providers? So there are lots of things. I can just give you one simple example. When we are doing a digital health project, the doctors were not willing to use any of our decision support system, which is a fact which is very well known. This is busy. We have too many patients, we can't use it. So we decided that we'll appoint nurses to help the doctors. When we appointed them, nurses, they said, are the thing is we wanted them to do coordination for NCD care, but the doctors felt they are nurses. They will do bandaging, they will provide drugs, they will give injections, and so much so the whole system collapsed. We just changed the terminology of the nurses and reappointed them as NCD care coordinators. Even simple things like that can make a big change in the adoption of digital health. So there are various solutions, but many of these should actually evolve from your own experiences.
Thank you so much, Dr. Prabhakaran. I think all very valid, and a lot of these are also captured here. So if I were to paraphrase what you're saying as well, Dr. Prabhakaran, I have a couple of follow-up questions for you. So one, I think at a foundational level, we are seeing infrastructural challenges, right? So there are issues around, the digital divide, around, the infrastructure of, let's say, the digital infrastructure of, of the geography, issues around gender, and the fact that digital literacy itself is poor, right? So the ICT penetration, as well as several socioeconomic determinants that play a role today in hindering access. And I think at the other level, there are also challenges with actually deploying these solutions in the system, right? And some of the things that were pointed out by our audience members, as well as Dr. U. Prabhakaran. One is, let's say, how does even a healthcare worker see value in the deployment of the solutions, right? So where is the incentive, or what really is the is something that she or he sees in being able to take this solution and get this to the ground? So what are some of the methods? And you talked about surveys and the fact that this needs to be designed with the communities, without which this is hard to do. And I think the other aspect, Dr. Prabhakaran, which would also love to have your thoughts on, is the solutions themselves, right? So in an earlier interaction, I remember we had spoken with a couple of industry players, right, where the focus on digital health solutions is to look at the lowest hanging fruit. The lowest hanging fruit are people who are upwardly mobile, the cream of the cream in some sense, and who are competent digitally, who will then adopt and look at these solutions. And the thought at that point was trickle down effects will work, right? So as these folks start to adopt, and then solutions will trickle down. But we've also seen that that is not necessarily true, right? And the exact point that you're talking about, Dr. Prabhakaran, is which is about solutions not being designed with the community and the context being very critical, including cultural contexts. How do you see this challenge, Dr. Prabhakaran, and particularly from a solutioning standpoint, do you see this as a hindrance in terms of solutions focusing on these segments of the population?
Right. I think, I just wanted to comment upon the word trickle down. Trickle down has not been successful anywhere. In fact, it was used by the neoliberal economists who said that if you create hundreds of high net worth individuals, there'll be trickle down effect and the whole citizenry will become rich. So that never happens. So similarly here, if you focus on the creme de la creme, as you suggested, I don't think we are going to have scaling up of digital health systems. So I think the solutions we have to think out of the box. We have to think innovatively in terms of providing solutions for democratizing the digital health solutions. I think the innovations, as you said, should be you should look at the low-hanging fruits. The innovations have to be really frugal, in the sense it's not going to be expensive both to the healthcare providers as well as to the patient. Second, in terms of the healthcare providers themselves, they should be proud of the fact, they should be enthusiastic, and they should be excited about the product they're using. In fact, amongst the non-physician healthcare providers, I have found that excitement because they are talking to people. They are providing, advice in terms of lifestyle, in terms of follow-up, in terms of treatment to these patients wherever we have tested this decision support system. We need to overcome, of course, the infrastructural barriers. So one of the things is many of the primary healthcare centers in many parts of the country have been solarized. So can we use solar run batteries instead of electricity, for example? Can we use offline data collection and syncing the data when our internet facilities are available? So I think we should look at it in a very futuristic manner. And currently there are several, as you are rightly pointing out here, there are several digitally inactive centers. Even providing them with simple internet can be of great use. A tablet and a simple internet of great use, but also encourage where there are facilities but remain unused. And that's also a big problem. There are facilities that are available. People are not using it. They think that it's too much work. people are frightened of technology. Some people think that they're not very adept at doing that. So there are a lot of things. So capacity building is also required. Short bursts of massive capacity building would be extremely useful in terms if we have to scale up digital health technologies across the country.
Thanks so much, Dr. Prabhakaran. I think very valid points, all of them. I also want to touch upon one additional aspect before we move to the next section on the challenges themselves is how do you think, Dr. Prabhakaran, so what do you think are some of the challenges in terms of, solutions themselves being able to, for example, be deployed in public health systems? So they face today barriers in terms of, let's say, the complexity of the regulatory landscape, challenges with being profitable as they deploy in some of these markets. And do you see that as a hindrance today as well?
So, I think the challenges are opportunities. They are a hindrance. When we start out anything, when we start out any disruption, there will be challenges, there will be naysayers, there will be people who will oppose. But as we go along, because when we look at the life cycle of any new disruption, you will find there are people who are called as early adapters. Then you would find people who are somewhere in between. Then you will have late adopters, and then you have laggards who will never use that technology. So that's the life cycle of any disruption. But how do you enhance something which is good is basically dependent on factors which are not related to the technology itself. Obviously, the technology should be easy, it should be universally available, it should be easy to operate. But beyond that, regulatory issues are very important. I think we need to look at regulatory issues in terms of supporting digital health. The second thing is within the digital tools, one of the biggest problems is the interoperability. And I think if we can actually overcome interoperability, and which we have overcome in the telemedicine program that we are doing, I think that will really help us in terms of overcoming the challenge. The third thing is what people call as phygital. That is, there is a physical component and a digital component. In our programs, we have both the components, and I think that is extremely useful, where there is an assisted telemedicine which can provide assistance to people to access the telemedicine program, but the consultation is remote. Lastly, I think when we reimagine health systems, I think thinking about our current health system, it's not going to be the future. The future should be somewhere which is a hybrid. There will be some physical contact and some virtual contact, particularly for chronic diseases. For acute care, of course, you need to go to the hospital and take care. But for chronic diseases, apart from the first encounter, or maybe 4 years down the line, another encounter, most of the things can be done in terms of virtual care. And that's a possibility, and that's being done in many places now.
Thanks so much, Dr. Prabhakaran. I think that's a very important point as well in terms of looking at, digital health not in isolation, right? And that's not the answer. It's really about phygital models, and it has to be person-centric at the end of the day. I don't think you can remove the person out of it. So I think this is, again, we are getting a lot of questions on the chat, but maybe we will complete our next, section, Dr. Prabhakaran, on the segue into solutions, right? So how do you think we can, what are the interventions that you think we should look at to make this happen? And I think particularly, what is the role that nonprofits as well as philanthropy can play here? We do have several of, representatives from these ecosystems on the call today. And I think looking at actionable recommendations for this ecosystem will be very helpful.
Right. Thank you for that. A very important point. I think first thing is we need to look at what is there actually in terms of policy. There is a big push, and that's a real plus point. The AVDHM, ADHM, all the things that we are talking in terms of digital health, the PM Wi-Fi access network interface, the so-called digital Saksharta mission, Digital India Bill. I think all of them are pushing us towards using digital health tools. But I think in terms of promoting it, there are three groups of people who will play a major role. One is the government, philanthropy, non-profits, and fourth, of course, is the market itself. The government, I think, requires to provide that last mile connectivity and infrastructure, not necessarily for health as a bundled solution to multiple programs, be it finance, be it banking, marketing, many other things, procurement of agricultural products and so on. So I think if that infrastructure is there and the primary healthcare centers and the secondary healthcare centers, the health and wellness center are provided with those kind of solutions, ensuring that it is possible to use digital health, I think that will help. In terms of philanthropy, there are various models that have been done. First is incentivizing adoption among healthcare providers and citizens by innovating newer models of care, piloting them and looking at whether they work or not. Then helping reducing the friction for solution providers to navigate the system complexities. People may come up with solutions, but they're unable to get it to the market. And so philanthropy may help, for example, in terms of providing some incentive initially, guaranteeing that, so let us say that they're working with the government, there is a delay in the payment. If we can guarantee that, there is no period in which they are not financially troubled, that can help. So some examples include blended finance and outcome-based financial instruments for incubating digital health and solution startups. Non-profits can help in terms of creating awareness in the general public, helping the citizens for onboarding on the ABDHM program and getting the ABA number, for example, and collaborating with academic institutions in terms of capacity building, in terms of piloting some of the solutions, evaluating the solutions, using the academic institutions or the other academic nonprofits for mentoring some of these startups so that they go for scale up. Awareness campaign. There are multiple things, and there are some examples. There is an example called Digital Life Care, in which we are also involved peripherally. It's a program run by the government of India, but the product was developed by Dell along with Tata Trust, 1MG, and several others, and it's being piloted in multiple parts of India. Currently, we are working on a pilot in Punjab to look at whether outcomes are improved. So that's an example. There are multiple other examples, of course. And finance is the biggest elephant in the room. So if we can ensure financial viability and support these startups as they are trudging along this course of getting new products and scaling them up, it will be extremely useful. And for that, I think philanthropists as well as we have this CSR model, CSR support, for example. Even venture capitalists and angel funding, many of these instruments are there, but many times, many of these startups fail because they do very well initially, but they have difficulty on scale up. So industry or groups of people who are adept at scaling up should support them and should help mentor them. I'll stop here. I don't think I've answered everything possible, but there are many other things that are possible here.
No, absolutely, Dr. Prabhakaran. And I think you've covered many of the points. Just to maybe add and nuance some of the things, I think the point that you're making about financing is a critical one. I think there is especially if we need more solutions to innovate for the last mile, more solutions to be able to deploy it in low resource settings, which means the paradigm of how the solution itself operates has to change, and the design of that solution has to be vastly different. So I think the incentive models to ensure that those solutions are discovered, they come in, they're able to thrive is a critical piece, right? And I think philanthropy can play a very, very strong role there in supporting the deployment and running these pilots, even aiding with discovery of these solutions as well, and also supporting with some of the hindrances that they face, like you pointed out, Dr. Prabhakaran, including, let's say, navigating the whole regulatory landscape that exists. So some guidance around that, supporting them with potentially longer sales cycles that may exist in some of these settings. So creating financial instruments that can support them through that process. And of course, you talked about newer instruments such as outcome-based financing and so on that can also play a role here. But again, very targeted at digital health, specifically to make sure that the outcomes are linked to these digital health interventions. I think that's very useful. The other piece that you touched upon, Dr. Prabhakaran, which is again a very critical piece, I think that needs solving for, and where both the nonprofit ecosystem as well as the philanthropic ecosystem can play a role, is really about working with health providers, right? So whether it's the frontline worker, whether it's the doctor, whether it's a technician, how do we, build their capacities in a way where they are brought, it's designed with them. Again, the same point, Dr. Prabhakaran, that you mentioned about community, I think applies to this ecosystem as well, because the value again to these people have to be clear if they have to adopt, right? And we've also seen instances of, the adoption having failed because of really no value being seen from some of these solutions. So, thank you for laying all of that out. And I think very important points again. I do want to, I think there are already questions coming in, Dr. Prabhakaran, so it might be helpful to maybe address and answer some of these questions already. Grantika, do you want to just read out some of these questions? Would love to hear from the audience members in terms of any questions that you may have across the, all of the areas that we touched upon today. Please do leave your questions on the chat as we answer the first set that are coming in.
Sure, Lakshmi. So I think Archana from Chitkara University had a very valid question on the lack of financial support and platforms for startups. And I think we have partially covered it. Aditi is...
Grantika, if I may come in here, I think there are certain things which are in the offing. I was in a meeting for a G20 program, and I believe there is a large amount of funding that are likely to be available to support digital health, particularly through major funding agencies across the world and major governments. It will be on the lines of somewhat like the PEPFAR funding or the Global Fund or the Gavi funding. So something similar is likely to happen at that level. But at a lower level, I think there are several organizations, maybe there are several people in this group who do fund such programs, but they want return on investment. And some of them are not really looking at profits, but they're looking at something like social impact. There's some, can a new tool provide some social impact? And there are measurable indicators by which they try and provide fund. So returnable grants, at zero interest rate and low cost or concessional debt financing. There are several mechanisms which people are thinking of.
Yeah, that's right. Thanks, Dr. Prabhakaran. So there's another question that Aditi is asking, which is around overcoming the barriers that patient face with respect to solutions such as teleconsultations. She's asking, given that patients cannot conduct certain physical examinations with a level of accuracy, example, palpation of lymph nodes, how do we sort of bridge that gap, given every time if we have to have a layer of health human resource in between, that is probably not scalable. So how do we overcome such barriers?
Right. I just want to give the example of a program that we are piloting in Chennai. It's called Digi Sahayam. Digi is for digital and Sahayam in all the Indian languages is help. So what we have done there is we have put together some of the technological things, like we have a point of care device which can do multiple blood tests. Then we have electronic decision support system where the nurse or the community health worker inputs data from the patient, and it provides a personalized management plan for the individual. There is a drop-down menu actually in terms of taking history. For example, somebody comes with fever. There are 5 or 6 questions that need to be asked. Is it a continuous fever? Is it coming intermittently? How does it subside? How long does the fever last? And do you take any medicines? So there are drop-down questions which they can look at and ask. They're also trained in terms of some few simple physical examination. There's an electronic stethoscope, which is much more clearer than the usual stethoscope, and a doctor sitting thousands of kilometers away can hear that very well because it has noise cancellation feature. We have added AI-enabled ECG. We're adding retinal camera and
Right.
photography. So there are multiple things that can be done. So we can overcome this particular problem of physical examination. Of course, if the nurse finds a lymph node, the person will require a biopsy and may have to be sent to the hospital. So it's a combination. So when you're reimagining the health system, as I said earlier, you need to look at both the physical component as well as the digital component. Digital component will not work for all the problems that we face. It may work for some 40–50% of the problem. Even that is huge.
Right. I think phygital is definitely the way to go, and digital health is really not the answer to all of our problems, but it's really the means to the end that we want to collectively achieve. I think Ajit has a question around if there are any studies that on the use of telemedicine for primary healthcare versus specialist consultation. I believe that he's asking the questions around the accuracy of both models.
Right. There are, I'm not aware of any formal empirical study, but some of the studies which we have conducted suggests that primary care physician empowered with a digital system, the outputs are very similar to what the specialists. I mean, I go way back to 2010 when we created this electronic decision support for the management of hypertension. And the output that the electronic decision support system gave was compared against specialists. Like we have a person with blood pressure of 160/100,
Right.
50-year-old male, no other symptoms. So it gave a certain output. It said you have to give an ACE inhibitor 1 unit and then call the patient back. So we asked similarly the specialists what would they do. So there was an 84% agreement, which is very, very good in terms of the system. So there are studies like that, but head-to-head comparison of primary care physician managed versus a specialist managed system, I don't think, I'm not aware, at least.
Right. I think that this is also underway, Ajit, if I may answer your question. I think there are studies today that are looking at these different contexts in a smaller scale. So multiple pilots that are being executed, not just in India, but also in, in Africa and other LMIC countries where some learnings are coming in. But at scale, this is yet to be done.
Thanks. Thanks, Lakshmi. I think there is a very interesting question from Aishwarya on the behavior change aspect of it. She's asking, how do we encourage the doctors and other health professionals to understand and adopt solutions like HMIS, e-prescriptions, etc.? And what will it actually take to increase the demand from the provider side?
I think, as I said earlier, we need to engage with the community in terms of co-designing intervention. Similarly, we need to talk to the doctors, because what is the biggest fear the doctors have? Number one, I have 50 patients in a day to see. How will I have more time to look at these digital solutions? Number two, will it take away my autonomy? Number three, because we are actually putting in a community health worker, am I going to become redundant? I think these are fear which every doctor has, and I think we need to allay this fear, saying that it is task sharing that we're doing. We are easing your workflow, and therefore it will benefit both you and the patient. The outcomes for your patients are going to be much better. So these are the kind of arguments that we have to have, and unless we educate them, but actually co-design the intervention with them.
Mm-hmm.
It won't work. Yeah. So co-design is the word that we have to look at.
Yeah. And just to add, so I think one of the things that also came up through earlier interactions and from some of the other work that we have done is that it's also, while we co-design and look at value for these, for the doctors and other health professionals, it's also important to remove disincentives. Right? So today, for example, there is there are cases where you fill in data online, you also fill in a register parallelly, which means you're adding to the burden rather than reducing the burden. So how do, as we pilot and design these solutions, I think it's also important to keep in mind that some of these friction points and disincentives should be removed, because these then operate as barriers as well.
This is a very important point. Actually, I'll just give you a non-health example. You travel and claim reimbursement. Now you have your boarding cards, which are available on your phone and on your email. But there are organizations which still ask for the paper boarding card. So it takes a lot of time for people to change their mindset. And I think it's very important that we try and change the mindset. And you rightly pointed out that we are overburdening the system by maintaining both paper-based records as well as e-records.
Thanks. I think there are a couple of questions around data safety. So Reena is asking how safe is patient information online? Similarly, there is a question around in case of digital intervention for preventive healthcare support, how do we adhere and maintain confidential aspect of any intervention? I think it's especially important in the lines of mental well-being, SRHR, and so on. So how do we actually maintain patient confidentiality in this scenario, sir?
So I mean, the patient confidentiality is very similar to a physical consultation. If you're doing an assisted telemedicine, for example, there are two people who are getting that information, the community health worker as well as a physician. So what applies to your physical consultation will apply here. Having said that, there are data which are in the cloud. How do we ensure safety and privacy for that kind of data? There are people are evaluating multiple methods for that. And one of the things people have suggested is using blockchain technology where the access lies with the patient. But that's little way off because even people like me don't understand what a blockchain is. So that's one example. But you have this two-point access where you have a password as well as a phone number, SMS system before somebody accesses the data. That's a possibility. But the truth being told is that, yes, there is a little bit of a problem in terms of safety, and it's a constant work in progress to ensure safety of that data and privacy of patients. 90%, I would say it can be done, but there is always that small component which is there, which is part of the problem across the board in terms of these digital solutions, not necessarily health.
Right. So, and I think some of the way, at least just to add to what you're saying, in design, at least the Ayushman Bharat Digital Mission is something that it has kept this at the center of the design process. We need to make sure that the implementation of it is adhered to in some sense, and hopefully once the PDP bill comes in, some of these aspects will be taken care of as well. But I think consent and privacy are critical pieces that we need to. I know there are we have time for a couple of more questions before we.
I just wanted to add one more thing. There are special situations. I think we have to be extremely careful. One is mental health. Second is HIV. Third is children. I think here we need to look at special ways of protecting them.
Yeah, if I may add, I think even in Ayushman Bharat, by design, they are now creating the ABHA account, right, over and above the ABHA ID, which allows the patient to keep certain records separate, and they have the autonomy on what record to share with what kind of care provider.
Yeah, the DigiLocker is a good example.
Yeah. I think there is a question from Anunaya. He's asking what, in your view, could be a pathway to sustainable implementation of digital interventions for the marginalized population?
So I think the answer is the same from what we have been saying. The one is, first is we have to design whatever intervention we do with the community. Second, we need to educate the community with regard to the utility of the whole program. Third, I think the building the trust is extremely important. Trust is an important thing, and demonstration that it works in cities, it works in other locations, so that you can make it aspirational is another way of doing it. And local stakeholders, local leaders, role models, and others can also help in promoting digital health. So I think there are multiple ways. I mean, the answer is a generic answer. And there's nothing specific that we can do to improve there, except building that trust so that more people use it.
Yeah. I think also this underscores the point around it being targeted, right?
Yeah,
So it's contextual, targeted. When we work with these marginalized populations, it has to be local, hyperlocal in terms of how we drive these adoption mechanisms and so on. So I think the context becomes critical.
So I think the follow-up question is also there, which they're asking is there a pathway that we should insist the ecosystem commits to? Whenever we redesign a health system, because it's a complex intervention, it's not a simple intervention like giving one tablet and seeing whether it works or not. It's very complex, and there are ways and means of looking at how that works. And so that is where the community champions and involving patients are very important. And once we do that, there are different ways of evaluating whether it's a successful program or not. And one mechanism is to see, is there a wider reach? Is there a good implementation? Is there a maintenance? Is there a sustainability? And is there enough access to care? So there are various ways of looking at these things.
Yeah. I think there is also a question with respect to specific target groups, right? Like there is a question from Gautam who says, how do we look at women who do not use digital devices in rural areas? Is there a way to have a specific targeted focus on these groups?
So there's no straight answer to this particular question. When we started this program, this question was asked time and again, women do not have phones. What do you do about it? Now, unlike in the West, where care for any individual is individualistic. I mean, you may be a part of a family, but the information is known only to the patient and not to others. Whereas in India, the system is very different. Everybody in the family knows. So generally, somebody in the family will have a phone, and so we might have to use that phone. I don't know of any other way if you're going to use digital health, unless there is some specific information which the women does not want to give. If it is a very generic information and it's generally used for the regular management of the patient, I don't see any problem. If there is a confidential information, obviously there is an issue and we cannot use the system there.
Right.
I know we have only 2 more minutes to close. I'm not sure we have time for more questions, but be assured that we will respond to your questions offline as well. I do want to look at just summarizing what we discussed over the course of the last 1 hour. I think we spoke about why digital health is critical, why contextualization for underserved populations is very important. We also spoke about some of the challenges that we face both at a foundational level in terms of infrastructure, literacy, and socioeconomic challenges, because of which digital health solutions don't penetrate. We also spoke about specific solutions, challenges with respect to solutions being deployed in terms of not designing for targeted populations, not looking at having the bandwidth to deploy in low resource settings in terms of both their ability to sustain in that environment from a profitability standpoint, as well as navigating some of the regulatory complexities that exist. And then we said that there is a critical role here for philanthropists as well as for the nonprofit community to accelerate and build the proliferation of digital health solutions. For nonprofits, particularly looking at low-hanging fruits such as building awareness, looking at enhancing the the push towards ABHA and so on, and also looking at creating channels for solution providers to be able to implement and try out their solutions effectively. And philanthropy, particularly looking at creating ecosystems for support and proliferation of these solutions, whether it's reducing friction in terms of helping them and guiding the solution providers to navigate system complexities, whether it's looking at creating an environment where business models in low resource settings can thrive, putting together innovative instruments, whether it's blended finance or outcome-based financing, to support the execution of these and scale up of these solutions, as well as creating incentive models for providers across the ecosystem to innovate and build value for the providers themselves as they implement digital health solutions. So thank you so much once again, Dr. Prabhakaran. If you have any last points to make, would love to have that, and then we can close with that. And thanks very much to our audience as well.
No, nothing, Lakshmi, you said it all. I mean, there are, of course, a few things that we might not have said, but all I have to say is this is an evolving place. It will take some time for it to settle. But these are really exciting times in terms of changing the face of the health system for the betterment of the population. So thank you very much, and have a good day.
Thank you very much, everybody. Thank you so much for joining us, and we'll be in touch. Thank you.